Many Medicare beneficiaries are drawn in by flashy commercials about Medicare Advantage plans promising the sun and the moon. But focusing too much on a plan's extra benefits can get you into trouble. Coming up next, we'll discuss what you should prioritize when making a Medicare Advantage plan selection so you don't get misled. When choosing a Medicare Advantage plan, we feel you should focus first on what matters most. Things like access to your doctors, expected medical and drug copays, and the plan's performance. In general, this is the order in which we would recommend analyzing Medicare Advantage plans. Number 1, what Medicare Advantage plans are offered in your county? Number 2, are your medical providers in network with the plan? Number 3, are your medications well covered? Number 4, what are the copays for covered medical services? Number 5, what's the plan's medical max out-of-pocket limit? Number 6, what's the plan's Medicare star rating? And number 7, what extra benefits are included? Okay, number 1, what Medicare Advantage plans are offered in your county? A quick way to see the plan offerings in your area is to use the Plan Compare tool at Medicare.gov. We prefer you work with an independent Medicare agency, but there's no problem starting the search at Medicare.gov. This will enable you to get an idea of which insurance carriers are a presence in your area and whether they are offering PPO plans, HMO plans, or both plan types. Remember, PPO plans give you access to both in and out-of-network coverage, while HMO plans only allow in-network coverage except in emergencies. The next two items are kind of interchangeable. If you have a lot of medical providers that are important to you, then your next step will be to confirm if those doctors and facilities are in network with the plans you're considering. But if you have a lot of medications, then your next step is probably going to be checking which plans cover your medications well. For this video, number 2 will be, are your medical providers in network with the plans you're considering? If you don't check this ahead of time, you could get into serious financial trouble. If you receive medical care that is out of network or not covered at all when a provider won't bill your plan, you won't be happy. There are a couple ways to confirm if your providers are in network with the plans in your area. Call the provider's office. Call the insurance carrier. Look up providers online. Or use an independent Medicare insurance agency. We prefer you work with an independent insurance agency, as they can verify this much quicker and with greater accuracy. You really need to know which networks to look up, and an independent agent is well equipped to do that. Number 3 is, are your medications well covered? This topic alone can greatly determine which plans you consider. You may love a certain plan's benefit design, but if it doesn't cover your list of medications well, it's probably not the right one for you. Unless you've made other arrangements to obtain certain drugs that are not covered by your plan. For example, assistance through the drug manufacturer, or a GoodRx.com coupon. You can use Medicare.gov or an independent agent to narrow down on the plan offerings that cover your drug list at the lowest expected out-of-pocket cost. Number 4, what are the copays for covered medical services? All Medicare Advantage plans cover the same medical services, those that Medicare requires them to. However, every plan is unique and can have a different copay or coinsurance owed for each medical service. If you see a doctor quite frequently or get MRIs every 6 months, you want to hopefully find a plan that has a lower copay for those services. Every Medicare Advantage plan has a summary of benefits that shows you the coverage categories and what those copays will be. Number 5, what's the plan's medical max out-of-pocket limit? Every Medicare Advantage plan has a max out-of-pocket limit for covered medical services. This varies from plan to plan. Obviously, the lower the max, the more appealing it is, but try not to focus too much on the max out-of-pocket limit. Since Medicare reduces the cost of medical services to a fraction of the real-world cost, it can be difficult to reach your plan's medical max out-of-pocket. Number 6, what's the plan's Medicare star rating? Medicare rates each Medicare Advantage plan annually based on various performance metrics, such as how well they manage chronic health conditions, your access to care, member satisfaction, and customer service. The highest Medicare Advantage plan rating is 5 stars. Anything under 3 stars is considered a poor performing plan. If it's under 3 stars for 1 year, that isn't necessarily cause for too much alarm, but if it's consistently underperforming, then you may want to consider other plan options. And number 7, what extra benefits are included? Okay, now we get to the extra benefits. In my opinion, this literally should be your last consideration when deciding on a Medicare Advantage plan. I get it, the extras are appealing, but please don't place too much emphasis on these. And here's why. Extra benefits in Medicare Advantage plans are, well, extra. They're above and beyond what Medicare requires the plans to do. So that means they can be removed entirely the next year or reduced. So instead, treat these extras as bonuses. If you can take advantage of them from year to year, great. But please don't make them your number one reason for selecting a plan or switching plans, when there are several other important factors to consider first. While we're on the Medicare Advantage topic, take a look at our video right over here on the pros and cons of Medicare Advantage plans.